Tenuto Medical, where everything matters. Company presentation 2020. Tenuto is taking a completely different approach to cancer screening and tumor classification. Our liquid biopsy test measures thousands of biochemical changes influenced by the tumor's presence and expressed in the immune system and plasma, rather than looking at one or more known markers. In the market today, there is nothing else like it. Approved, clinically backed, and ready to market. Established science. 700 plus of patient datasets collected. 4 peer-reviewed publication. Ready to market. CE mark for multiple indications. Established model. Commercialization partners engaged. Clear product roadmap. Breast cancer test kits ready to market. Rich pipeline to follow. Rich IP portfolio. Multiple patients covering the technology and wave numbers. The need for better breast cancer tests. Billions of dollars invested, yet current detection methods frequently do not meet today's market needs. Mammography and ultrasound offer low sensitivity or specificity. Especially poor results are shown in many populations, such as young women and women with dense breast tissue. Tumors may be detected too late, when they have already developed and are more difficult to treat. An invasive biopsy is needed to classify the tumor as benign or malignant. The current breast cancer patient's journey. Screening mammography. No better than a coin toss. Less than 55% sensitivity in dense breast population. Diagnostic mammography / ultrasound. Biopsy examination. 50 to 80% redundant. Most biopsies are unnecessary due to mammography's high false positive rates. And treatment. Liquid biopsy tests frequently miss. Liquid biopsy techniques look for tumor fragments, which are shed by the tumor into the blood, as well as other immunomarkers for diagnosis. Tumor fragments are often absent in small quantities of blood in the test tube, especially in early stages of the disease. Immunomarker-based techniques aren't sensitive or specific enough. A new approach where everything matters. Better outcomes by measuring subtle changes of the influence of cancer presence on the biochemistry of immune system and plasma. For a correct diagnosis, everything matters. Our TBIA technology rigorously analyzes all the signals expressed by a tumor's presence in the blood, from plasma to mononuclear cells. Our test is the only one to create a biochemical picture that is unique for different populations: healthy, benign, malignant. The test can be applied to multiple solid tumors. To look at everything, we integrate the traditional with the novel. Traditional, mid-infrared spectroscopy. Biochemical tool for analysis. Robust, quick to deploy, inexpensive to buy and operate. Off-the-shelf products with no reagents needed. And novel, new use of FTIR and AI. First company to conduct peripheral blood analysis using FTIR and apply it to clinical use. Proprietary AI of the Spectra and cloud computing create unique biochemical pictures of patient health. TBIA is more reliable than the analysis of one or more known markers, providing answers within 24 to 48 hours. Standard blood draw via company's kit. Mononuclear cells and plasma separated. FTIR analysis with proprietary algorithm. Results reported to the doctor. Classifying healthy, benign, or malignant. Raw spectra generated by the FTIR. Proprietary algorithm enabling population classification. Peer-reviewed publications show high sensitivity and specificity. TBIA outcomes were reviewed and published in prestigious journals and conferences. 86% sensitivity, 98% specificity in a 190 patient study. Design. Perspective. 2 arms, 1 enrichment, unblinded. The results were compared against known gold standard methods: mammography, ultrasound, and biopsy. Objective. Identify healthy and benign breast cancer. 89% sensitivity, 80% specificity in 59 patient study. Design. 59 patient proof of concept study for breast cancer screening. Perspective. 2 arms, unblinded study. Test results were compared against known gold standard methods: mammography, ultrasound, and biopsy. Objective. Establish a methodology for creating breast cancer detection algorithms. Breast cancer testing huge opportunities. USA, 33 million tested, age 40 plus. Europe, 16 million tested, age 50 plus. Opportunities for a screening test for younger women not being tested today, a biopsy prioritization test to reduce unnecessary biopsies, approved tests offering a better patient journey, mass population screening test, assess if a malignancy is present or not, special attention to young women and women with dense breast tissue, targeting women aged 25 and older without a diagnosis of inflammatory or autoimmune disease. Biopsy management. Distinguish benign from malignant tumours, diagnosed as presenting with BI-RADS score of 3 to 4, targeting women aged 25 and older without a diagnosis of inflammatory or autoimmune disease. Strategy. Rapid rollout, growth and expansion to new indications. Global commercialization and regularity plan. 2020. Demonstrate clinical adoption in Europe. Focus on generating sales in selected EU countries using diverse B2B and B2B2C models. Europe. CE, transition to new CE. Asia Pacific, advance locally, such as PMDA in Japan. 2021. Expand territories and commercial partners. Additional EU territories, Asia Pacific, Latin America, Africa. Engage with commercial partners, local, regional, global. Reimbursement, evidence-based to support reimbursement. Ongoing efforts to increase the number of regularity approvals in multiple territories. Launch of test kits for multiple indication, including lung cancer, colorectal cancer, and ovarian cancer. Where everyone matters. We meet the needs of key players in the healthcare system. Patients, simple blood draw, early detection and timely intervention, fewer redundant biopsies. Physicians, actionable information, better outcomes, helps prioritize the need to biopsy. Healthcare systems, keeps treatment costs low, immediately deployable, measurable improvement in the quality of care. Tenuto Medical, sometimes it isn't a specific thing that matters, sometimes it is everything. Disclaimer.